Okay, we'll begin this monthly meeting of the El Paso County Board of Health. I'll start off with a member roll call, and I'm going to start with Doris Ralston. We know is missing today because she is on a vacation with family, so she will not be here. Commissioner Bremer.
Present.
Dr. Deborah Chan. Dr. Richard Vu.
I'm here.
Councilmember Dave Donaldson.
Here.
And Commissioner Lojinos Gonzalez.
Here.
Okay, and I do not see Mayor Glant Havener. And I will reserve some comments about General Jack Briggs for just a few minutes. Has everybody had a chance to read the agenda? If so, I need an approval or a motion to approve the agenda.
I'll move to approve the agenda.
Thank you, Dr. Chan, and a second.
Second.
And thank you, Commissioner Bremer. All in favor of approving the agenda as written, let it be known by saying aye.
Aye.
Aye. And let's open it up for board member comments. Let's see, anybody, I'm going to start over there with Dave Donaldson.
No comments at the moment.
Okay, how about Dr. Vu?
I guess I have one comment. I just wanted to express my appreciation for all the staff here at Public Health and recognize the good work that we're doing and all the work that we do that many people do not see. So thank you.
You bet. Commissioner Bremer?
Yes, thank you. I had the opportunity to travel with Director Whelan to Nashville and present at the National Association of Local Boards of Health. I do believe it was an engaging presentation to a packed out breakout room. And what occurs to me when I go to, whether it's the National Association of Counties or this group, NALBO, is that in El Paso County, I think we do an awful lot of things right. And of course, anytime you go to those conferences, there are things that you can pick up and learn from other jurisdictions as well. But I will say that I get the distinct impression that the way this department is run is really kind of a step above, maybe quite a few steps above the way things work across the country. Everything from the dynamics of this board and how we interact, the diversity of who is represented here, and then the way that the health department staff is managed and works directly with our public on the things that are in your charge. It always makes me very proud to say that I'm from El Paso County, and Susan did an excellent job and is well respected by her peers nationally as well. So just an honor to be there and represent El Paso County. Great job. I wish you all could have been there and seen it.
It was Nashville. We all wish we could be there too.
Pretty much only saw the inside of a conference room, but.
What did you present on?
It was entitled Breathing Life into the Public Health Story, and it was about weaving public health information, education, and utilizing the stories of citizens and people to explain what you all do every day.
Wonderful.
I'd like to tag team on that. Is my mic on? Okay. So, oftentimes I have the opportunity to present at national conferences or state conferences or even local venues, and we, Commissioner Bremer and I, really appreciate the support that we had from the communications team from the El Paso County and doing a podcast actually demonstrating different ways that we do tell stories in different modes, and also my team here at El Paso County Public Health. I see a few members of the communication team, Pamela and Michelle and Glenna. We couldn't do what we do without your support. There's a lot that goes into having a successful, interesting presentation, and so I just wanted to give a big thank you to the support that was provided and the energy in the room at the National Association of Local Boards of Health. There were people coming up to us and wanting to ask many, more questions and get connected and take photos with us, and like, well, we have to go. We need to catch a plane. But it was really wonderful, and any time that we have Board of Health members that are presenting and representing our agency, I think that it really takes it a a level further with interest, because I know that there were county commissioners that serve in dual roles across the nation that were engaging with Commissioner Bremer, as well as numerous different board members, and trying to learn more. And I know, Mr. Colas, you also, the previous year, we had presented together too. So I think that's really, it's not a given. We submit an abstract, which our team member, our development officer, had helped us with the concept and writing that, Carolyn Gary, and it's a competitive process related to whether you get selected or not. So it's wonderful to be able to share the good work that everyone's doing on our team, and including the Board of Health on the national level.
Thank you. Continue with comments. Dr. Chan.
I have no comments.
Okay. And Commissioner Gonzalez?
Thank you, Mr. Chair. So I did have one comment. I think it relates, Councilman Donaldson might expand on it, but I believe the city residents of Colorado Springs initiative process put recreational marijuana back on the ballot in November. If this board wants to consider being able to influence that, we probably need to take a serious look at doing a resolution opposing that, if that's the desire of the board next month, because if we wait to October, the ballots will probably have been just dropped already by the time we were to do any kind of comment in October. But if that's something for consideration, which I seriously would support, opposition to recreational marijuana ballot, the vote, I think that needs to be considered for next month. Thank you.
Okay. Councilman Donaldson.
Just to add a little to what Commissioner Gonzalez said, in Colorado Springs, medical marijuana sales are permitted. They're legal. In Colorado Springs, recreational marijuana sales are not permitted. And citizens did gather enough signatures to put that on the ballot to allow recreational marijuana sales. So yesterday, council voted. We have two choices when citizens gather that many signatures. We can enact that law, or that ordinance, which the citizens have gathered the signatures for. We can just make it law, or we put it on the ballot to let citizens vote on it. So that's what happened yesterday. We put it on the ballot. There's also going to be a ballot measure to change the city's charter to not allow, essentially it won't allow councils to unilaterally allow recreational marijuana sales in the city. Citizens could still gather signatures, put it on the ballot. So it might be a little confusing for folks when they get their ballot, because there's going to be competing recreational marijuana sales ballot items there. One would make it legal for those sales. The other would actually change the city charter and not allow recreational marijuana sales. The only way that could be overridden would be to gather a bunch of signatures and put it on the ballot again. So having heard myself say that is probably confusing, but you're going to have two choices there, and I'm happy to talk more about it if anyone wants to hear it. And we did this 2 years ago, right, Commissioner Gonzalez? I believe we did this as a board. I don't think the information has changed. If anything, it's gotten more concerning about the effects of high-potency THC. So I think I would support doing that.
I have a question about this measure. In the event that the citizens of Colorado Springs vote in favor of recreational marijuana sales, what are the restrictions on the amount of taxation that can be imposed by the city?
Yeah, and off the top of my head, I don't know. I don't know if there is a limit. There are things in that measure which will be on the ballot, the measure to allow the sales, which I believe dictate kind of where it will go. Like what would the tax income be used for? I believe. I haven't paid much attention because there was a real question if they would be able to gather enough signatures. Initially, they turned in the signatures. There weren't enough valid signatures. They had to go out, gather more signatures, and they did get enough the second time. So I don't have those. I can find out next Board of Health. I can have that answer for you.
Okay, so the ballot measure might have information on how revenues might be used, but it does not delineate what the percentage of taxation might be on a sale? on the sales?
I don't know off the top of
Okay.
my head, yeah.
And Dr. Vu, did you have a comment also?
Yeah, I just want to verbalize my personal opinion as a physician. I personally would oppose recreational marijuana. Thank you.
Thank you. Okay. I said I would reserve some comments about General Jack Briggs. He is conspicuous by his absence, and General Jack Briggs has resigned his position on the El Paso County Board of Health because he's no longer the head of the Springs Rescue Mission. And his position with the Board of Health was directly related to his role as a leader of a nonprofit. And so General Briggs is no longer with us, and I think that we are going to definitely miss his contributions, his intelligence, and he went from a very storied career in the military directly back into service. He served at a major university on the East Coast. He came to the Springs Rescue Mission, where again he rolled up his sleeves and he served this community. And now he has moved on. We've just heard that his new position is with the University of Colorado in Boulder as the assistant director to emergency management. I believe I'm saying that correctly, but it just is another step in a very long and storied history of service to his community. And his community could be global, as it was when he was a general. In the Air Force, his community can be very localized, as it was with the Springs Rescue Mission. And now it's his community is those students and staff and faculty at our state's largest universities. So we're very grateful to have had him, and he will definitely be missed. Go ahead.
May I add to that?
Please.
I would echo all of those comments and thank General Briggs for his service, and also just to update the public on the process. Your county commissioners will be taking a look at and posting that particular opening on this board. It again does need to be. There are certain sectors that it can represent. And so we'll be looking closely at that and look to fill the seat as quickly as we can.
Okay, I've got a couple more comments. One of them is that, I don't know if one of the board members got this, I think you all did, but just to draw your attention to Board of Health member trainings. The trainings are available to all of us, and spoke to Susan just for a few minutes before the meeting, and she had mentioned that she's actually, I think it was with Commissioner Bremer, she sat down with Commissioner Bremer, went through the trainings with her, and they did kind of a joint learning session. And that would also, she would make that available to anybody that wanted it. But I think it's important for all of us to get the background information about how this board operates and how the boards of health in Colorado as a whole operate. They're not the same all around the country. So how we operate in Colorado is an important thing for all of us to be well aware of. So if you would take a look at that, board members, I'd certainly appreciate it. And please reach out to Susan if you have any questions, or if you'd like to sit down with her or a staff member to go through any of the training. Then I would also like to mention that our surroundings. We've made a permanent move to this conference room for our Board of Health meetings. Now, many of you know that for several years we met downstairs in the big conference room, and that was really necessitated during COVID because of the amount of public comment that we got and the amount of public that just came to our meetings and wanted to sit and be a part of our meetings. And so we wanted to accommodate that and make room for those folks. That room is under a lot of competition for that space, especially during the election season. We'd be booted out anyway. So I think this move is a timely one for us. It puts us back in familiar ground, much easier for the tech staff to set up the technical support in this room rather than downstairs. It will probably keep us from having to bounce back to the Centennial Hall on occasion when that room is being used. But I do want to make this, state this publicly for all of the public of El Paso County, that if anyone on the board perceives a need for greater space so that we can accommodate public comment or public attendance in the future, we will make that move. We will, just as we did in the past to accommodate the need for the larger meeting space, we'll do that in the future as well. But I think we've all seen, every one of the board members has experienced with me that in the last year or so, public comment and public attendance has really fallen off drastically. And we don't perceive the need for the additional space. If we can do it here and not restrict anybody's access, then we certainly think that this is going to be much easier for the technical staff, much easier for our staff, and for and just a very stable place where we can meet and count on this meeting space month after month. Any additional comment on that, Susan? Okay. All right, let's see if I can move on from here. We need to get a motion for the approval of minutes.
I move approval of the June meetings.
And I'll second. Councilman Donaldson.
Okay, thank you, Commissioner Bremer and Councilman Donaldson. Anyone are all in favor of approving the minutes? Let it be known by saying aye.
Aye.
Aye. Okay. And it passes unanimously. Now we're going to open it to public comment. Looking at Michelle, do we have any public comment or anybody? Oh, okay. No, we don't have any public comment. And we have got looks like some proclamations. Recognize September as the National Suicide Prevention Month.
Mr. Chair,
Yes, sir.
if I could, just an alibi on opening comments, and it has to do with really the public. And yesterday, we heard a lot of public comment at our city council regular session from citizens who live up around the Ford Amphitheater, and the impact that the sound coming from the amphitheater is having on them, their children, their sleep, their pets, but I'll stay away from animals. We'll just stick with people. And that's a real, I mean, it's something that perhaps, even this board will take a look at if there aren't steps to mitigate the sound coming from the Ford Amphitheater, because we've received hundreds of emails about this. I think thousands of homes are being impacted, and some of them cited studies with folks who live within a certain range of airports or other places where there's just kind of chronic noise and the impact it's had on their health. And it has impact on blood pressure, a few other things. So there is something going on in our city, which is, and this is really sort of a public health thing. It's impacting a broad number of citizens who really want to just enjoy the peace and quiet in their own homes, and that's being changed by the amphitheater. And they, anybody can download a decibel app on your phone. I've done it, and see what the readings are. And they're getting readings up in the 70s during these concerts, and they're recording it and sending it to us at council, the actual from their maybe security cameras. And the thumping, it's very much like someone pulling up out in front of your house with a car with big bass speakers and just thumping away for a few hours. And so I hadn't thought of what role public health could play in looking at that, but I may talk with Susan about that afterwards. I know county commissioners are receiving complaints about this too, so kind of an interesting thing. I hope today, I know that the mayor is meeting with J.W. Roth along with President Helms from council. I hope they can come up with some ways to mitigate the sound and keep it within the amphitheater. So thanks for letting me say all that.
Sure. Okay, and that brings us back to the recognition of September as National Suicide Prevention Month. And Susan, you want to tee that up for us?
Sure, I'll ask Brittany Rifle to come up. She is our public health planner, and we have numerous different partners. Actually, not as many as we have related to the collaborations, but we do have a few partners here, and I will go ahead and let you lead this.
Awesome. Well, good morning. My name is Brittany Riffle, and I'm the Youth Suicide Prevention Planner for El Paso County Public Health. I have the privilege of leading the Youth Suicide Prevention Work Group, which has been in existence for over 8 years, and to also be embedded into suicide prevention work happening across the county. I know there are a lot of priorities within public health, and it's meaningful to us in the suicide prevention and mental health space to have this time on the agenda. And to recognize complex community issue. So thank you for investing the time today in this awareness proclamation. In 2023, there were 196 El Paso County residents who died by suicide, 16 of whom were youth between the ages of 10 and 18. It is estimated that 115 people are impacted by just one death by suicide. So if you do some math, approximately 2,200 or 22,540 people in our community have been impacted by suicide loss. This morning, I would like to invite us in this room and those joining virtually for a moment of silence for those lives lost to suicide. Let's take 16 seconds representing the life of each young person who died last year. Thank you for joining me in this moment. I brought a few people with me today, and they'll be joining in just a second. These are people who have dedicated their lives and careers to supporting the mental health and wellness in our community. For many of us who work in this space, we don't get involved, or we get involved because of personal connection to suicide loss, lived experience, or supporting someone living with a mental illness. So our stories are interwoven with the work we do every day. I've been involved in this work for about 8 years and had no idea it would lead me to this space working alongside each of you and the people that I'm surrounded with. I have listened to people's stories of loss and grief. I've had my own personal journey of feeling like a burden to those around me. And I've also seen moments of hope where people are alive today because someone supported them. So as we share today and the proclamation is read, let us remember those whose life have been lost and those who have stayed even through difficult times. So I'm going to have my friends join me up here. We have friends join me up here. They're just sitting there. And so we have 4 individuals. So we have Cass Walton from Suicide Prevention Partnership. She represents many suicide prevention efforts in the community. We have Dr. Lauren Eckhart from Children's Hospital, who represents the Healthy Communities Collaborative, as well as the Youth Suicide Prevention Work Group. Julie Hendrickson from Academy District 20, who is an amazing partner, does amazing work throughout her school district. And then David Galvan, who is our workplace wellness, faith-based community liaison guru of all things related to suicide prevention in the community. So I've invited them to share and just take a couple moments and connect the work they do with stories for you all today. Who wants to go first?
Lauren, Cass wants to go first. Good morning, everyone. Thank you again for investing the time in this critically important effort for our community, for our kids, for our families, and for ourselves. I have the honor and privilege to represent Children's Hospital, also the Healthy Community Collaborative, and the Youth Suicide Prevention Work Group. And I guess I get to start because I get to share a story of hope and a story of steps towards recovery for a teen in our community who was struggling, who we treated in our day treatment program starting last spring. She came to us with debilitating depression and anxiety. She's a 15-year-old girl who stopped playing volleyball, which she loved. She stopped spending time with her friends and stopped attending school. She was sleeping in bed with her parents, and this had been going on for months. Within 2 weeks of being in our program, on the first day of the program, it took 3 hours and 3 of our staff members, highly trained, to even get her into our classroom. By the end of the 2 weeks with us, not only was she engaging with her peers, she was making eye contact and standing in front of our class. She went back to school several weeks ago and is now making A's. She had a boyfriend over the summer who I am actually very proud to report that she broke up with because he was pushing too far and wanted to do things she was not ready for and exerted very appropriate level of boundary and, more importantly, respect for herself and the work that she had done. And she is slightly angry and disappointed with us because we are pushing her towards discharge and recovery as she transitions back into this very successful school year in her original homeschool without any modifications whatsoever. So this is why we all do what we do, to provide these stories and these opportunities for families towards recovery so that they will stay. Thank you.
And I'm going to ask a question with that. With someone who's a success story like that, would she have any role with your program in the future, telling her story and being kind of like a peer advocate?
Yes, so we are actually working closely right now with some of our teams in Denver to bring a nationally recognized peer and family support program called Friedla and get some training for folks. We're also working on standing up a youth advisory council. And then within children's, we nominate kind of patient ambassadors every year, and they each serve a 2-year term. And I'm also proud to report we had our very first Southern Colorado ambassador selected a year ago, who was one of the very first patients that we treated in our outpatient clinics. So yes, lots of opportunities for that
Great.
to be shared.
Great.
Thank you, sir.
First, I just want to thank all of you for all the work that you are doing as well, too, with this. And so I'm Julie Hendrickson, as Brittany said. I'm the Assistant Director for Counseling and Academy School District 20. And our community partnerships are huge with El Paso County. And so we really want to focus on stories of strength with our students as well. We try to really share that sometimes through no fault of our own, like we get knocked down. But let's celebrate those stories of strength and that there is hope out there. And so our community partnerships, we couldn't do this work alone like we just talked about. And when we are in the thick of this and when we're dealing with a crisis, the faces in this room, from Children's Hospital to El Paso County Public Health to Pikes Peak Suicide Prevention, they're my first phone calls. And so when I see their faces, I just know they're coming along to help us along this way. But we have shifted from the medical model in District 20 to the public health model, where we have trained 100% of all of our staff members how to ask these questions, how to recognize it, because we know sometimes students aren't going to ever walk into a school counseling office, but they might have a really rock star trusted adult who's a teacher that they trust. And as long as they're talking, we don't care who they're talking to. We just want to talk about that conversation and share that the more they talk about this, the more normal that conversation becomes, and that it's okay, you're going to get through this. And it's really sharing those stories of hope. And so we just thank you for all of your support and all of Brittany's support as well as we walk this path together. Okay.
Good morning. My name is Cass Walton, she, her. I serve as the Executive Director for Suicide Prevention Partnership. I also have the honor of serving as the co-chair for the Suicide Prevention Collaborative of El Paso County. I sit on the steering committee for the Youth Suicide Prevention Work Group here, and I also co-chair with Lauren the Suicide Prevention Committee for the Healthy Community Collaborative. So I get to be a part of all of the hopeful things that are happening in our community. And while, as Brittany reports those numbers, it feels so dismal, I just want you to know that what that report doesn't capture are the lives that are being saved every day. And I know those lives are being saved because I am on a regular basis told, I am here because. I am here because of these programs that are happening, because of my trusted adult at school, because I'm able to access services at our different community partners that are working so hard in our community. And so I just wanted to highlight some of that in my talk with you today. You know, one of my favorite poets, Maya Angelou, she said, paraphrasing, when you know better, do better. And we are seeing that happen in live time in our community. And that's evidenced with the over 800 students that we were able to reach last year in our partner presentation with Diversis Health and NAMI of Colorado Springs, the What's on Your Mind, which is just a basic presentation of when might you need help and where do you get it from, which does such a huge, is a huge step in just normalizing the conversation. We lifted up the LOSS team, which are local suicide outreach to suicide survivors, and we partnered with the coroner's team to have suicide loss survivors deployed to the scene of a suicide to provide immediate support. Because research tells us the sooner that we can put that support in place, the more positive the outcome will be. We have partnered with the El Paso County Sheriff and CSPD to include QPR and the CIT, the Crisis Intervention Training that's happening for our first responders. We hosted 2 assist trainings here at Public Health, which was really nice. I love your building. We entered into a formal agreement with Colorado Springs School District 11, which has resulted, they were already doing great work. They were already doing a great job as D20 and getting all of their staff trained, and we were able to help them with that. But then we were able to take it a step farther. This past month, we were able to take a look at how they're doing suicide screenings and what their crisis response looks like. And we were able to meet with all of their mental health staff to really work through that process. We've increased active collaboration with families in need of support at D20. Julie and I work together a lot, and I just really appreciate everything that she's doing. We hosted pastoral breakfasts with our local faith leaders to talk about how do we normalize the conversation in our churches? How do we make sure that where we know folks are already going for support and comfort, that they're receiving appropriate messaging? We partnered with 'Cause I Love You, and we had over 1,000 discharge care packages created for local residents who are discharging due to a mental health inpatient stay. We've attended roundtable discussions hosted by Thomas Thompson from the mayor's office regarding workplace well-being and building bridges between our community providers and our military installations. And this is just some of the work that's being done. So while, a lot of times maybe the media or in just general anecdotal talk, people are talking about things that are really scary and hard, there's also a lot of really hopeful, strategic, and just amazing collaboration that is lifting this community up in a way that we have not seen before. And so with that, I'm just so grateful for proclamations like today, because all of that is signaling to our community in a very tangible way that we take our wellness seriously, and that this is a conversation that we're all interested in having, and that it's a valid topic to be addressed. So I just want to thank all of you for today, for the support that you've given in the work that's being done, and I want to acknowledge all of our community partners that are doing this amazing work. So thank you very much.
Good morning, Board of Directors. Oh, gosh, Cass, this is right here with me. I didn't see that. I know. You're here wedges, too. That's why it's there. Thank you, Board, for leading and promoting. I was reading your vision statement, that idea that you're leading this effort to promote and prevent and actually be those that are championing public health in our area, and it's specifically today around suicide prevention. We know that a community that loses people are impacting so many, as Brittany already mentioned. I read a post from 988 that came out yesterday, and this post was a quote, and it said, "Public speaking and storytelling can be negative, like a negative or difficult to journey, especially when people are more interested in sound bites than your journey." And I hope today that we don't get sound bites out of what we've said, but we actually get change. And Henry David Thoreau says this statement, he said, "The great masses of men and women lead quiet lives of desperation." And I hope that we move from quiet desperation to honest conversation about suicide prevention. Like, what does that look like within our faith communities? And so I want to share a story of a youth pastor and a youth leader that impacted a life that's here today because they went to a training. I said a few weeks ago, actually the first week of August, towards the end of the night, most people left. A leader rushed into the auditorium, and as I was the last staff member in the building, our volunteer leader panicked and rushed to me and told me there was a student talking about taking their own life. I rushed to the lobby to find a mom who was panicked about her daughter's boyfriend. I walked over to this individual who was crying with his girlfriend on his shoulder, and I asked to speak with him privately and start a conversation. I've never done this before. Actually, he says here, and he said, "I prayed to the Lord that I would never have to use the training that David provided. But in this moment, it was everything that this individual and I needed." I was able to talk to him and uplift him and encourage him and give him a light in a dark moment. What seemed overwhelming at the moment, an argument with his mom, a threat from his dad, caused him to contemplate taking his own life. Without the training that we had received, I wouldn't have known what to do. I was shocked on how well this individual responded and how he became open immediately. This training, I believe, is something every staff member, volunteer, parent, and everyone should go through. I leave you all with that because what we do is we provide a public health approach, like Cass said, to say, there's a story in my faith that talks about the Good Samaritan. And you come up and you can bind those wounds each day and go and see another Good Samaritan, do your job each day. But when will we ask what's wrong with the road? When will we ask what do we need to change? What needs to happen so we don't see this every single day? And I hope today one of those statements is this: my hope is that we will become a city where no one loses hope and no one's alone. Thank you.
Awesome, thank you. I have a few more comments. So we represent a large work of people doing this work in the community. So I just wanted to read a few more quotes. Also on your tables, you have these stickers that say "You are enough." We wanted to leave these with you as a thank you to just representing us in the community. And then also the 98 Crisis Lifeline is on here, and it says "There is hope." So those are today, and for those in the room, there's some on the back table as well. But just a couple of closing comments, and I'll pass it back for the reading of the proclamation. So these are some comments from people we work with every day. I've personally and professionally witnessed increased collaboration of care throughout stakeholders in our community. Thanks to the efforts, we have seen increased access at the appropriate levels of care, as well as additional support have been added to our community, ultimately saving lives. We came together from multiple organizations to create a robust resource list to help support mental well-being for youth and their parents and caregivers. A student approached me in the hallway and shared that one of the trainings they had received in their class around mental health first aid was the most impactful training he had ever been to. A local family received financial assistance to cover the cost of a funeral for their child who died by suicide. We have significantly increased suicide prevention training opportunities for teachers and staff in our school district. And I did a quick poll, and there was over 4,000 El Paso County residents who have been trained in suicide prevention in the last 18 months. And then the outreach and prevention program at TESA have benefited by increasing great resources to share with students, as well as connections to other serving organizations. So these are just a few of the highlights of the great work that is happening today that is really represented with this proclamation. So thank you so much for this time, and I'll pass it back to the board.
Okay, I'm going to just see if any of the board members want to comment on anything you heard this morning. No, Dr. Vu.
Thank you. Thank you, Brittany. Thank you, your team and all the leaders in the community in this effort. I'm trying to quantify the value of your work. I'm trying to quantify the value of a life lost by suicide and the value of all the lives that are prevented from suicide. And I don't know if I can give a number to that, but the closest I can come up with is infinity. So thank you for your work. Thank you.
Dr. Vu.
Okay, well, I want to thank you too, all of you, for the work that you're doing. 36 years as a first responder, as you were talking, I had a lot of flashes go through my mind of scenes that I've been on, and the devastation that is left by the family members are left in when somebody has taken their life by suicide. Preventing that kind of hurt is good work. Thank you.
Thank you.
And Commissioner Bremer is going to be reading the proclamation for us, I believe.
Sure. And then are we going to take the rest of the board comments following that, or should we make?
Or,
the
no,
other
make your comments
now?
now, yeah. I thought we were done.
Thank you. You know, I was struck by the first speaker who came up and mentioned the age range at which this becomes an issue. And what I'm impressed with is that I feel like from a public health perspective, this community has done a really good job of getting ahead of even those 10-year-olds, right? With coping mechanism skills and grit training, and we can name all these other things that are starting much earlier before the word suicide is mentioned, but giving and empowering the youngest of our citizens and sometimes the most vulnerable to negative thoughts, with creating positive environments around them, I think is really important and unmeasurable to the work that you guys are dealing with kind of on another end of the spectrum. And so anytime I'm looking at efforts we're doing, whether it's at the county or Department of Health or anything, I'm wanting to take that bird's eye view of how do you actually get ahead of these things, what programs are effective in doing so, and that tells us as decision makers where our resources need to go, and most of the time it is not something that can be solved by policy. And so to see these efforts that really are, yes, you all are focused on prevention, and you're seeing, when it reaches a crisis point is really the point at which this group I see in front of us is dealing with. But to know that on that collaboration, on that collaborative committee and the other task forces that have been stood up, people are paying attention to how much earlier we can equip our young people to deal with things that seem like the hardest things in the world. But if we can teach them the skills to cope with that now, we have not only the ability to get them alive and through their school years, but with job skills and other things that also provide hope throughout their life. So all of that to say, the work you're doing is so very foundational. I'm sure it's easy to get discouraged by, for every story of hope, there is a devastating one. And so I'm grateful that there are people in our community that are taking those to heart, learning from it, and trying to figure out how we do get in front of those prevention efforts. So with that, I'd like to move approval of the following proclamation of the El Paso County Board of Health recognizing September 2024 as National Suicide Prevention Awareness Month. Whereas the month of September is nationally recognized as Suicide Prevention Awareness Month, a time used to raise awareness about the importance of mental health and how to recognize signs and symptoms someone may experience if in a mental health crisis. And whereas there were 1,290 deaths by suicide in Colorado in 2023. And whereas 196 El Paso County residents died by suicide, and thousands of their friends and family were forever changed by these losses last year. And whereas in El Paso County in 2023, suicide was the 7th leading cause of death for people of all ages, and men accounted for a disproportionate 77% of those deaths. And whereas, though El Paso County saw an increase in youth suicides in 2023, our upstream suicide prevention efforts with partners throughout the county are expanding. And whereas youth mental health suicide and prevention has been a top priority for El Paso County Public Health, who convenes the Youth Suicide Prevention Work Group, a collaborative of community partners taking collective action in support of youth mental health and suicide prevention. And whereas the local community and the Youth Suicide Prevention Work Group are deeply invested in layered suicide prevention efforts, and the Suicide Prevention Collaborative of El Paso County, the Healthy Communities Collaborative, and Pikes Peak Rising. These collaborative efforts have a collective goal to reduce suicide deaths in El Paso County by 20% among all age groups by 2028. And whereas El Paso County Public Health recognizes suicide as a complex community challenge, and each life lost impacts many families, community members, and those who diligently work in suicide prevention. Together, we are changing the conversation about suicide by replacing myths and stigma with information and action steps that everyone can take. And whereas El Paso County Public Health urges all El Paso County residents to take action and prevent suicide in our communities by learning about the risk factors and warning signs, as well as local resources, reaching out to someone who has had a relationship end, has had financial challenges, or is navigating grief and loss, asking about suicide directly, and staying connected to those you care about. And whereas El Paso County Public Health invites residents to take steps for suicide prevention by attending and supporting one of the local walks or running events occurring this September through Weekends of Hope. Now, therefore, be it resolved that the El Paso County Board of Health recognizes September 2024 as Suicide Prevention Awareness Month. Moved, seconded, and adopted by the El Paso County Board of Health at its meeting August 28th, 2024 in Colorado Springs, Colorado.
So we'll need a motion to accept that proclamation as written.
Motion.
I guess the motion goes with the reading of it by Commissioner Bremer, so.
Second.
A second by Dr. Vu. Any comments on the proclamation?
Comment, this
Yes.
discussion. So I know that there's clear correlation between use of marijuana, and I'm talking about recreational marijuana, with mental health diseases. I'm not sure if, I don't know if data, if there's correlation between marijuana and suicide. I'm assuming there is some kind of correlation, but Dr. Chen or Bernadette, I don't know if you know of any data.
I don't know of any data, and I'm not certain if the correlation is the chicken or the egg.
Correct, not cause and effect with correlation. Right.
I do believe our coroner has some statistics, just in general statistics about substances found upon autopsy
Yes.
in some cases, but I'm not sure of what those percentages are.
Yeah, I think those two observations are correct. So the coroner does a suicide investigation, toxicology, drug testing will be done. But to use the word correlate is what's
Correct.
difficult, right? So it is found to be present.
Yes.
Sometimes it is found to be present with other drugs. And so to say that it's correlated, just so it can be present. I'll get back to you in terms of the numbers, because we have that information from CDPHE's vital statistics as well. And then and I think we've done this in the past, I don't know the number off the top of my head, for youth use. We can also just share just youth use patterns across, just in general. So the percentages are not terribly different, just in terms of general use as opposed to use found, substance found in someone who commits suicide.
Okay. Thank you.
Councilman Donaldson.
Yeah, thanks, Mr. President. Not long ago, we had Dr. Ken Finn come here and present, and I don't think he has any hesitation to tell you that there is a relationship between especially chronic and heavy marijuana use, those elevated levels of THC, and mental health problems and disease, schizophrenia. If we want to hear it again, I'm sure he'd be happy to come back and give us an abbreviated presentation one more time.
And Commissioner Gonzalez.
Thank you, Mr. Chair. Just a quick search on National Library of Medicine study from last year, 2023, did review many cases. It just gave a general that, again, correlation. Evidence generally showed a positive association between cannabis use and suicidal ideation and attempt. So again, it tends to be
Perfect. Thank you.
correlation. Yeah.
I have another comment unrelated to marijuana. And of course, I fully support the proclamation, and I want to thank everybody for your time today and reminding us of the individual impacts as well as the ripple effects of loss of life as well as prevention of loss of life. And certainly I understand the emphasis on prevention of youth suicide, since these are individuals who are full of potential and have many years of life enjoyment and contribution. Within the proclamation, there is the information that 77% of suicides are by men in our community. And I think that this might be a population that is somewhat neglected when it comes to reaching out and letting them know that there are avenues of support. I think that societally and culturally, our community tends to promote the kind of strong silent masculinity. And I think it's very important in terms of public health to promote men's health, not only in suicide prevention, but in all other aspects of chronic diseases, as men have a higher death rate from these chronic diseases and a shortened life expectancy.
No, I just wanted, just as a heads up, we are actually in process. So last year, the agency developed a dashboard specifically for suicide and overdose deaths. This has been a common request. Oh, sorry. Oh, I had done that wrong. A common request from the public and from all the partners that we work with. And so we're actually in process of updating that dashboard, which should be rolling out imminently in terms of adding 2023 data. And that's exactly the point. So suicide rate among males is 3 to 4 times higher than females. It has been that way consistently in our county and the state and nationally, for that matter, for a long time. And so we will reference that dashboard when we respond, and please have a look at it. There's some very simply displayed but sobering statistics in there about the differences in our suicide rates, including among our teens. So thank you. Thank you for bringing that up.
Okay, Councilman Donaldson.
And I think the doctor knows this, but attempted suicide numbers might be much closer. Men tend to use guns, blow their heads off. Women tend to clean the house first, then take pills. So there's just a different outcome. And I don't know that we're ever going to be able to change that. There are differences between men and women. Men commit a lot of crimes, women don't. So I don't know if we'll ever be able to make it equal, that we can have equal representation in successful suicides. And that's just kind of biology is part of it. So I think, and for those watching, I mean, that's an important thing, that men use different means to commit suicide. Pills can be that can be a plea for help. Guns are pretty final. So.
Medically, we're taught that the more serious suicide attempts, when people are really serious about making sure that they're successful in their attempt, they're going to use a more lethal means. Whereas, like you said, cries for help can often be means that can be pulled back or somewhat less lethal. But I think that generally what I'm trying to emphasize is that we need to stop vilifying men in our society. We need to support men. Internationally, of course, that's my background, is in international public health. There's always more funding for women and children than for men's health. And there's the saying that women hold up half the sky, but we need to remember who's holding up the other half.
Well, I support you on that.
I have 2 remarks that I would like. First, I think it's important to note that across demographics, we're seeing an increase in the use of firearm, regardless of sex, in deaths by suicide, in both attempts and fatal deaths. And so while that's been historically correct, Donaldson, these days we're seeing more and more even women and children accessing firearms for death by suicide. And so I just want folks to know that for prevention reasons, that, well, we only have women in this home, so we don't need to focus on safe storage, but it's really across all demographics that firearms really play a high role in deaths by suicide. And then the other efforts that I want to highlight in our community regarding outreach to men is just workplace well-being, right? So it's about going where men are. What we saw in countries like Australia, where they looked at their construction industry, which is one of the highest impacted by death by suicide, and they started using the assist training model to train their ground crews and their supervisors, and they created a peer support network. And it's similar to the thought process with Pikes Peak Rising, right? We know that not everybody is willing to ask for help. Not everybody is willing to go to a professional. So just creating increased access to support and increased capacity to our community by creating spaces that don't have as much stigma to get the help that you need. And so we're really hoping that with recent efforts with the Workplace Wellbeing Summit that we had last week, with ongoing efforts to create tools for workplace wellbeing, that we'll be able to access and reach out to more of the men in our community. Because the other thing that we need to think about is that all of these, many of these adults who are dying by suicide have children. And the impact that it has on a young person to lose a parent is really significant. And I know that because of the postvention that we do with young folks. And it is also really traumatic when it's the young person who finds their adult who's died by suicide. And so it has to really be a parallel process. And I would say it's just as upstream to help young people have parents who are well, so that we can all live in spaces and work in spaces and go to school in spaces that are healthy and safe and where they're able to talk about mental health.
Well, lots of comments and overwhelming support from the board for the proclamation that was written. I saved my comments to last, and one of the whereas clauses in the proclamation ends with this sentence. These collaborative efforts have a collective goal to reduce suicide deaths in El Paso County by 20% among all age groups by 2028. I think it's always important to have outcome measures, to have goals to try to achieve, but please know that 1% is success, right? You stop one suicide and you've made a difference. So don't get wound up with numbers. Just get wound up with the good work that you're doing and keep going. Okay. Board members, all in favor of accepting the proclamation as read to us, please let it be known by saying aye.
Aye.
Aye. And of course, there's no opposed. Passes unanimously. Thank you. Sure.
Okay to do a photo?
You bet.
Perfect. Pamela will direct us. Do you want to?
I got mine.
Yeah, let's have everybody kind of come first and probably help sign this thing. Yeah, you'll have to squeeze this space. There we go. Yeah. Maggie, can you push it? Sorry. Actually, I just have you all. That's good. Everybody? I need someone to direct this. You're good? Yeah. All right, here we go. Ready? 1, 2, 3. Just kidding. 1, 2, and 3 again. Perfect. Thank you very much.
Okay, that brings us to next item on our agenda is finance and budget. Go ahead, you're on.
Okay, we'll go with next slide, please. I'm Sarah Kinney. I'm the budget manager for public health. What I'm going to do, as we're covering 2 months, as financials work, June and July actually are encapsulated in July. And so I think it would be best use of our time, since we've had this opportunity to spend some time on suicide and do the proclamation in the essence of time. What I'm going to do is actually focus on the July financials. So let's go ahead and move on to the July slide on the next slide. Okay. And so that is a bit of an eye chart. So let's start with revenue. Our state and El Paso County funding is exactly on budget, so there's no questions there. Moving down to program-specific grants, this is again our standard timing issue. As you know, we just started our state year. We have that difference in the state fiscal year versus the county year, and we just approved all those new contracts here in July. So people are just getting started in executing those contracts, and there's usually about a 30 to 45 day lag on those. We also have a little bit of delay on our CDC workforce expenditures there. So reimbursements are a little bit behind our trend, but I do expect those will catch up prior to the end of the county year. Moving down to licenses, fees, and permits, I do want to spend just a moment here. Across the agency, we are just a bit below our trend here, and I do expect that to continue through the end of the year, ending approximately around $300,000 below our revenue trend for the year. This is about what we were under last year. However, the agency has been monitoring this closely each month, and I've been mentioning, hey, I think we may be a little bit low. And the division lead is also monitoring this very closely as well. And we've been holding some vacancy positions open, and I do believe the vacancy savings will fully cover this, this under in revenue. So I'm not concerned at this time that this will drive an overage over our budget authority. Any questions there? Moving down to Medicaid fees and insurance. We are getting more Medicaid fees and insurance in this month and last month. This is due to higher volumes in some of our clinic services, and I'll be watching this closely. If we have higher volumes in the clinic, we may need to come back to the board to get additional budget authority. I will leave that up to the public health director after we do additional analysis and the clinical services director review it. But that is good news that our clinic is doing an excellent service to the community, and I will leave that up to the operational team to decide. But we're doing a great job there. Our interest income is up again. This is due to the healthy fund reserve and the higher interest rates that we're receiving.
Got a question?
Yeah.
Go ahead.
So you have to come back for budget authority because of matching funds or because the acceptance of the funds?
So at the Fund 95 level, Director Whelan is allowed to spend a certain amount of money. If the clinics are getting additional revenue because they are spending money on supplies and getting additional services to the community with the same staff, they're doing more volume, and so they may need to spend and appropriate additional expenditures. So prior to doing that, we would come back to the board for that. We're not there at this point, so prior to doing that, we would notify the board. I'm not saying that we're there yet, but it's something I'm monitoring closely, and as I committed in March, you know, I'm just giving you that early warning that I'm working closely with the team. I let Summer South know, there she is, that, hey, we're looking close on our program supplies on immunizations and the reproductive health clinic because their team is just so productive and doing so great with their existing staff that we should keep a close watch. So as we're getting close to that mid-year, we'll be watching it, and if we come close, we'll come back to you guys and say, hey, we want to maybe re-baseline the budget at a higher level because their existing team is doing so much volume. Okay. Moving down to personnel. As you see, we have some personnel vacancy savings. I do not anticipate that those will be on the table at the end of the year. As you know, from time to time, there are other expenditures that come out of that account, things like retirement payouts or things like that. We do have some very tenured staff at the agency that have very healthy balances. I anticipate large payouts that could happen through the end of the year that could use that up, as well as other expenditures that could happen depending upon what the county commissioners do through the end of the year. So I do not anticipate that those savings will remain there on balance through the end of the year. On operating, we do have encumbrances well in excess of that $121,000. So this again is a timing issue in terms of when those invoices come in. On the capital account, I do expect that if you approve the ARPA resolutions that will be put before you today, this is a timing issue and we won't have an overage there in that capital account line. So that really covers all of our expenditures. I do anticipate that our net impact we will not be leaving any funds on the table. We'll be coming in closer to a net impact just under 100K left at the end of the year. Once we consider all the changes, if all resolutions brought before you today are approved. Any questions?
Go ahead.
Sarah, I just want to thank you and your team for the good work you're doing. Thank you.
Oh, thank you. Yeah, it's really the good work of the public health team and the program managers executing on the grants. As you know, grants are a huge part of what we do, and just the detail analysis work that they do so that we can get that reimbursable revenue, especially in clinical services. I think the really strong work that they're doing there has really helped us this year.
Praise God and thank you.
Yeah, thank you.
May I just add one aspect of this also? In your monthly report, I had committed to providing turnover staffing data, and so that is in there. And so when you look at the amount as it relates to the vacancy savings, just wanted to note that, but I also wanted to note that the license fees and permits is not exclusive for environmental health. We have various different license and fees or fees throughout the agency, and we have been intentional as it relates to holding some positions, knowing that we have over projected that in that area, and we'll monitor it closely. But I did want to point that out, that it will be a monthly update for turnover data in your monthly reports.
Yeah, and we also have had some big success in immunizations and ELC, where we'll be presenting in the resolutions those contract wins, which were not in the originally adopted budget. So that has really supported the team this year. As we have the COVID funds drawing down, the extra efforts by the development office and Director Whelan to win that additional revenue has really stabilized our revenue and helped us to continue to support the community. So that is really significant, along with that state LPHA funding. So very good news story for this month. Okay, thank you.
Thank you, Sarah.
Great.
Okay, moving on to our resolutions. The first one is for immunizations, and Christy Durbin.
Good morning. My name is Christy Durbin. I'm the Immunizations Division Manager. So as stated in your board packet in the contract synopsis, we are seeking your approval for the CDPHE contract extension for the immunization program in the amount of $1,224,370.37 for the state fiscal year 2025 to continue our work which supports decreasing barriers and increasing access to vaccines, including the COVID-19 vaccine. This contract was first approved by the Board of Health in 2021. This grant has extended COVID-19 funding that will not be renewing, and we are currently seeking approval for this extension. We are excited about the future of continuing to serve individuals in El Paso County, and I'm happy to answer any questions.
I don't see any questions from the board. We'll need a motion and a second and a vote to pass this resolution.
Motion.
Thank you, Dr. Vu, for making the motion,
I'll second.
and Commissioner Gonzalez for your second. All in favor of accepting this resolution, let it be known by saying aye.
Aye.
Any opposed? And there's none. Thank you.
Thank you.
Okay, epidemiology and laboratory contract. Let's see. Please say your name. I was going to try, but I
It's
didn't
all
want to get it
good.
wrong.
I'm used to it. Good morning, Marini Klaber. I'm the Program Manager for Communicable Disease, and I will be presenting on the ELC 2.2. As stated in your board packet in the contract synopsis, we are seeking your approval for this Epidemiology and Laboratory Capacity 2.2 grant from State Health Department for the Communicable Disease Program in the amount of $568,089.32 for the grant period August 1, 2024 to July 31, 2025, to continue and enhance our work which supports respiratory disease education, outreach, and mitigation efforts in high-risk populations, such as child care facilities and long-term care. The funding also provides opportunities to augment and modernize disease surveillance systems to track diseases in El Paso County. This grant is a one-time funding opportunity and will not be renewable. We are currently seeking approval for this grant. We look forward to the opportunity to provide our community with more advanced data visualizations, including those for reportable respiratory diseases, and I'm happy to take any questions.
Board members, any questions? No? Okay, do we need a motion and,
Move to approve item 8B.
thank you, and a second?
Second.
Thank you, Commissioner Donaldson. All in favor, let it be known by saying aye.
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 Aye, and thank you very much. That moves on to,
Sarah's going to present this one.
okay, for the America Rescue Plan Act.
Good morning. I'm filling in for Nikki Simmons. I'll try to explain it as clearly as she does. So I'm just going to take a brief moment and explain it the way she explained it to me. So public health estimates ARPA resolutions. The funds actually cross calendar years. And so when we put together the OAB budget, we estimated how much of those funds we would spend to the end of the year. And so we administratively say, this is how much will be in the OAB budget. Now, as we actually spend, we spent a bit more. And so the OAB budget wasn't the right amount to have in the OAB amount. So this is just an administrative change so that the amount in the OAB budget, or the revised budget for you, will be the correct amount. And that will be the same explanation for the state LPHA amount that we do in the next resolution as well. So this resolution to recognize revenue and appropriate expenditures for contract funding presented to the El Paso County Board of Health is for the federal government ARPA funding for COVID-19 in the amount of recognizing revenue of $151,376.26 and appropriating expenditures for building improvements of $151,376.26. And do I need to read the next bit?
No, I don't think so.
Okay.
Questions from the board? If not, I'll need a motion and a second.
I'll move to approve the ARPA resolution.
Thank you, Dr. Chan, and a second.
Second?
And Commissioner Gonzalez. All in favor, let it be known by saying aye.
Aye.
Aye. Any opposed? And there's none. Okay, that moves us to the recognition of the change of, let's see, this is the state local public health
And
agency.
so I'll clarify on this one. So when I wrote the resolution last month, I wrote the resolution for exactly half of the amount, and I think we had a clarifying question on my math there. But I did not realize about the administrative amount of crossing the years, and so I was corrected by the CFO of the county. And so this resolution corrects for the administrative amount of the correcting of the years, which is the amount of recognizing the state ARPA revenue of the negative $34,017. And then also, she let me know I should have appropriated the expenditures in the amount to personnel of $212,111 and to other professional services, $70,703. And this will appropriate, correct the ARPA funds for the state LPHA funding that we received last month.
Okay.
Sarah, you're doing great.
It is quite complex, but I'm very excited that we did receive this increased state LPHA funding, and this will, in fact, keep a net zero balance and keep the budget authority appropriate for Director Whelan to go into the fund balance to exactly the amount that the board intended. Okay.
Okay, I need a motion.
I'd like to thank you as well. The CFO likes to correct me a lot, too. Thanks.
Yeah. Well, she double-checked my numbers, and we got it correct now, so, all right.
All right, let's get a motion and a second for this. Dr. Vu, and
Second?
second from Commissioner Gonzalez. All right. All in favor of this correction, let it be known by saying aye.
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 Thank you.
Any opposed? And of course, there's none. Thank you.
Have a good day.
And that takes us to our director's report.
Sure. I have a couple of invitations or announcements before we get into the tuberculosis presentation that was requested by Mr. Donaldson previously. Wanted to mention that to invite members of the board to the Latino Luncheon, which is going to be held on September 11th, and I know, Mr. Gonzalez, you're not going to be available. You have a special birthday and some plans. But the Latino Luncheon, they have asked me to be the presenter, and I would greatly appreciate if there's anyone on the board that is available that day to attend. Please just let me know, and we can make those arrangements. Also, I wanted to mention that, you know, our agency is highly involved in providing statewide summits or conferences with lots of expertise. A previous one that we did that I think, Ms. Klaber, we had over 300 people attend the epidemiology conference from multiple different states recently, and we are also bringing the Colorado Environmental Health Association summit here, and our environmental health staff, Aaron Pablo, who is the conference chair. We have a few different officers from environmental health. One is a president-elect, Kara Small, as well as Ken Demers, who is a secretary. And this is significant because we are providing that expertise, and then we have an opportunity also to share with peer groups, and we're hosting that conference in the Great Wolf Lodge. And, you know, it's not being funded through our agency. However, we are bringing that conference to El Paso County. And so as we continue to have more expertise and more bandwidth, I think that it's wonderful that people are coming to El Paso County, and we're able to demonstrate some leadership in those areas. So if you have any interest in the Environmental Health Conference, let me know. Also, I'll be there in the morning and then going to the Latino Luncheon. And once again, greatly appreciate the communication team's help in providing the presentation support for the Latino Luncheon as well. Did you have a question?
I do. When is that conference, Susan?
September 11th. They're both
Okay.
on the same day.
And you know, that is my wife and my 34th anniversary on the 11th. And we're going out of town, but we were going to go to the September 11th ceremony at Memorial Park. But if that doesn't conflict with the Hispanic Chamber lunch, I will be there because you're going to be there.
Yes, and even if you could attend maybe a portion, but I'll get with you, and it's at the Cheyenne Mountain Conference Resort, I believe, and it's just on different parts of the town, but that would be wonderful.
You'll have to talk to my wife, though, about why I'm spending our anniversary.
We'll bring her along.
Okay, okay.
For the lunch. So now moving on to the presentation with TB, if Susan Garrett wants to come up, and then also Summer South, who is our Clinical Services Director for Reproductive Health.
All right. Good morning. My name is Summer South. I'm Clinical Services Division Director. And today we're going to be presenting to you all just an overview of the TB program in response to some of the questions posed at the last Board of Health meeting. Some of the topics that we're going to go over, we have the role of the TB program in our community, how we work to protect our community and ensure that we meet statutory requirements related to TB investigation and treatment, frequently used terminology within the TB program, and some data and trends. But before we get started, I just wanted to give a shout out to the TB team here at El Paso County Public Health. It is a small but mighty team. This team consists of 2 full-time registered nurses and a disease intervention specialist that serve the entirety of El Paso County population. So it is a big ask and a lot of work for a very small team. Very dedicated team, a very knowledgeable team. So I'm continually impressed, and I feel honored to be able to help support them in the function and roles that they perform. With that, our TB supervisor is out on leave currently, and so we've invited Susan Garrett here to present this information to you all as a subject matter expert. She is basically filling in for the TB supervisor in that role as a nurse subject matter expert in tuberculosis. So without further ado, thanks.
Good morning. I'm really kind of happy to be here today. Thank you. I wanted to briefly go over kind of priorities of the role of the TB program. The number one priority, can we go back one? Thank you. The number one priority is to investigate every suspect case of tuberculosis in this county, full stop. And then to do treatment and case management for every active case. Part of this treatment involves public health orders to place folks who are infectious on isolation. This is a standard thing we've been doing in TB forever, because what we really want to do is prevent spread in our community. And then we closely monitor people, and as soon as they are no longer infectious, we remove them from isolation. So that is our number one priority, to protect the health of this community. Number two is contact investigations, which is where we look at every single case of infectious TB, who they might have infected, and get those folks evaluated and treated if necessary. We also evaluate and treat all Class B immigrants and refugees. Those are folks who are identified overseas as having findings consistent with TB. So upon entry to this country, we evaluate them to make sure that they don't have active TB, even though they were tested overseas. It's a double check. We also do latent TB infection treatment for high-risk persons who do not have other resources. We can't provide it to the entire county. As Summer said, 2 nurses, 1 disease intervention specialist. We are very limited in our capacity to do that. It'd be amazing if we could do more, but we can't. We also consult with community providers pretty much on a daily basis. We get calls from, I think this person might have TB, and we talk through the evaluation. This person has latent TB infection, and we talk through the treatment options and help people problem solve and get access to treatment. And we do a whole lot of community outreach and education. This is last on the priority list, but it's also critical because it's another way we can evaluate the TB burden in our community. Some numbers we just can't get, but because we have such strong community partners, they call us if anything's going on. In fact, I got a call from a school nurse yesterday asking for information on a particular thing about tuberculosis. And that it really is a very, very critical part of what we do. Can I have the next slide, please? And I wanted to cover kind of contact investigations. This is a uniquely public health role, and it's one way we find many of our cases, and it's also a way to intervene early to prevent more TB in our community. What we know is folks are most likely to develop active TB disease within the first few years after exposure. So if we can catch people right after their exposure, determine if they've been infected, and put them on preventive therapy, we can prevent active cases. A big win. Next slide, please. And I wanted to cover some of the terminology about newcomers to this country. And the reason why is we have different access points, different data points, different things we can do. So next slide, please. So folks seeking permanent residency here pretty much come in 4 categories. Immigrants are folks who meet federal requirements to be a legal immigrant to this country, and they're granted permanent residence. Refugees are folks who are determined by the federal government that they are facing persecution or fear of persecution and are granted refugee status here. Parolees are people who enter the United States and then report to U.S. Citizenship and Immigration Services requesting refugee status. And then they're granted parolee status while their case is being evaluated. It's kind of complicated. And then, of course, undocumented folks have no involvement with the federal government. Next, please. And this becomes important for TB screening. So immigrants and refugees are both screened for active tuberculosis before they enter the United States. And an exciting development there, beginning this fall, they will be screened for latent TB infection before entering the United States, which has not been the case in the past. And this will then give us an opportunity to do early evaluation and treatment of latent TB infection to prevent disease. So we're actually very excited about that, although it will increase the workload in TB. People diagnosed with active TB outside of the U.S. must complete treatment before they come in. And then we evaluate and follow up any abnormal results. Parolees must obtain a blood test for latent TB infection within 90 days of entry. That does not have to be through public health. Public health is not notified of parolees, nor is public health notified of the results. And of course, folks who are undocumented, there's no screening because they're undocumented.
Go ahead.
Thank you. So you said the parolees, we don't get any information. Are we able to get any information on percentage that actually took the blood test?
We get
Nothing, okay.
It breaks my heart. It would be enormously wonderful if we got that information and could ensure follow-up. However,
Regardless of the results.
right. Yeah, sorry. Wish I could give you a different answer, but I can't.
Could I ask a
Why
question?
bother testing? Yeah, why bother
Do-
requiring that test?
Have you seen numbers of, say,
Because they're not gonna do
latent
it.
TB in native-born Americans? Percentages. I would imagine it's very low.
Off the top of my head, I can't answer that question, but yes, it's fairly low. Really, TB is an imported disease. However, we do have the occasional latent TB infection among U.S.-born citizens.
You've almost answered all the question with that one statement, that TB is an imported disease, generally. You've pretty much answered what I was asking last time, which is the point I was trying to make is that this is a public health, to me, a public health concern when the federal government doesn't control the border at our southern border and allows people in. It's sometimes called catch and release. We stop them at the border, release them into the interior, probably tell them to get a test within 90 days. How many of them actually do that? Who knows? Perhaps you do, but do you? No. And then the ones who are just the undocumented, it should be a real concern for public health concerned citizens and people like yourself who are really doing the frontline work. Do we, and perhaps you're going to get to this a little later in your slides, do we have numbers from El Paso County, like numbers of latent TB positive people in the county, those who would fall into these groups, immigrant, refugee, parolee? Do we have that kind of detail?
We just don't have
Okay.
numbers of latent TB infection. I wish we did, and we
Yeah.
don't. And the other thing when I said that TB is an imported disease, and then this is not data, this is just observations from here in the county, most of our cases of tuberculosis are folks who are foreign-born, and most of them are folks who have entered the country with documentation. We do occasionally see an undocumented person with active TB. It's actually pretty rare. There's no wood for me to knock on here. It actually is pretty rare in El Paso County. That's reassuring. And this is where our partners come in, because we can't track latent TB infection because it's not reportable, and it's kind of like tracking the number of strep throat infections. It cannot be done. What we can do, and we do, is we look at anytime we get an active case, so this is a person with actual TB, we go back and look and say, where did this person get TB? Does it make sense? Or can we not figure out, and does that indicate there's community transmission going on? And again, I don't know why y'all didn't give me a big block of wood here. But we're not seeing unexplained cases. We are seeing folks with known exposures or folks who have traveled, most recently somebody who travels internationally quite often for extended periods of time. So we do not see any evidence at this point in time, but we watch carefully, of transmission within our community. So that's,
I'm sorry, but by community, do you mean our city, our county, our state, our nation?
our county, that's where we have
Okay.
the good information on. There are some, I know of one different state that is having a problem with ongoing transmission within the state, but it's nowhere near us, thank goodness.
Which state is that?
I know there's an issue in Texas.
Okay.
But that doesn't mean there aren't issues in other states. It's just I happen to know that one off the top of my head. Next, please.
So
Oh, sorry.
I just want to clarify my understanding. What you're saying is that within El Paso County, the majority of cases that you've seen are imported cases, but they are imported through regular migration rather than irregular migration. And these are active cases. So these individuals could not have had active TB prior to coming in because they needed to be screened and completed treatment prior to coming into the United States. So is the presumption, because there wasn't screening for latent TB, that they had latent TB at the time of regular migration and may have converted to active?
At some point in time in the future, as we know, you can develop TB disease decades after exposure. And that's why I'm really excited about the beginning this fall, folks will be screened for latent TB, because I think we'll be able to make a difference there. But and an example of a recent case is somebody who's been in this country for a very, very long time and got started on the TNF alpha drugs, which inhibit your immune system and are a great risk for developing active TB. So that's one example.
Shouldn't they have been tested for that, though, before it started on TNF alpha?
Absolutely.
And maybe it was just a false negative.
Absolutely, they should have been tested in treatment. However, we have no control over that. That's up to the individual providers, and that's where we go there.
As far as the parolee policy, is there an avenue for feedback from local public health or state public health to federal government regarding the policy on that?
Yes, and I know our state TV program has discussed that. However, feedback and listening to feedback and changing policy, it's not in our control.
Right,
But
mean,
yes, our state, I know our state
I
health
think
department
that
has.
everybody can recognize that the current policy is completely, it makes no sense. It's completely without merit. If this is not going to be reported, what's the point in doing the testing? I mean, I think we can all recognize that there's a problem there. As far as screening for comorbidities or co-infections, are people who have active TB also screened for HIV?
Absolutely, 100%. In fact, anybody that we test even for latent TB, if it's positive, we do an HIV test because that is so critical in the course of treatment and the progression of the disease. That is, and that's an absolute. Very
Thank
few
you.
absolutes.
Thank you.
Next, please. And then just a review of other health screenings. and immunizations, which doesn't have a lot to do with TB, but just since I was explaining the different groups, I thought I would throw that in there. Next, please. So let's talk a little bit about TB in El Paso County. Next, please. One of the things, and this is a very hard to see slide, and I apologize, but this is this is where people come to from Colorado by country of origin, and basically the darker areas are where we get more people. And if you can blow it up enough to see it, in each country there's actually a number and the percent of the folks who come from there. So it's just kind of a picture of where people come from. And again, these are the folks who are documented.
What is that darkest country? I don't even know what that country is.
So, okay, let's look.
It's like a little bit northwest of India.
Right. Okay, who's better at geography than me? So it's slightly south of... I can't answer that question.
Okay.
We'd have to pull up a map. Geography is not my thing. Next, please. But here's the good news. This is incidence rates. Notice where Colorado is. We're in that really nice light-colored band in the center of the country. We have historically had low incidence rates in Colorado. And again, y'all didn't give me a block on wood, but knock on wood, we will continue to keep it that way.
That's
slide, please.
Afghanistan, for the record.
Afghanistan, thank you. That makes sense. And here are our case numbers over the past 10 years. As you can see, we vary between 1 and 10 cases per year. So far in 2024, we have 1 case. And it varies widely around small numbers. And some of those, I know you're going to pop out at those two, the 10 and the 8, like what happened those years. I know that that 8-year was because there was a family and there was transmission within the family before the first person was diagnosed, so there were several cases within a family. Can't tell you what happened in 2017, but probably something similar. These are not unusual jumps. The nice thing about this is if you look at us compared to Denver, we are in very good shape, although we are not very far away from Denver. And do you have a question?
Sure. Do you know what the number is for Denver?
It's right up
Yeah.
to up
Good
above
point.
us.
Yep. My
Oh, this year?
detective skills are a little weak today. Didn't see that. But nope, you've kind of pointed that out. But this one this year is 1 active case. We're not talking
1 active
positive
case that was
latents.
diagnosed in 2024.
That was reported to public health.
Yes.
But all of them should be reported to public health if it's in the county, or is that not true?
That is a requirement, and I feel very comfortable that that happens.
Okay.
Because we get phone calls, we get at least, I'm thinking this week, what is today, Wednesday? By end of day yesterday, I had 3 phone calls of what we call rule-out TB cases from the hospital. So yes, we get notified.
Okay.
Most of those do not turn out to be active cases.
Okay, thanks.
So our case rates, and it's really important to look at an average because with these small numbers, things vary. So our case rate, our 5-year incidence rate is 0.7 per 100,000 people, which is nice. We'd rather have it be 0, but that's a low rate. It is very reassuring, and trust me, we watch this carefully. Next slide, please.
Do you know, ma'am, what there is sort of a trend upward there. I mean, 89 is the highest on the whole chart, total for the state. What is it this year total? Do you know that
For
so
the entire
far?
state?
Yeah, for 24, what is this, 24?
So they will not report that till the end of
Okay.
sometime mid next year. The only thing I can really track, because we know about every case in El Paso County, is El Paso County. We have heard anecdotally about an increase in Denver, but I can't give you numbers because Denver won't report it to us. It's just the way they put things out.
Do you know, like, from working in this field for years, if someone is a undocumented person, illegal alien, do they seek to get care without going? They don't want to be reported to public health because then they're being tracked somehow. Would it make sense that they try to get treated kind of under the table or off the record?
I'm kind of thinking.
Have you heard of that? If you haven't heard of that, or you think, no, never heard of it.
I have not heard of that, and I do know that I have both here in El Paso County and in other jurisdictions where I've worked, evaluated and treated folks who are undocumented. And we make it very clear to them because our number one priority is to kill that germ. Of course. Period, end of story. So we make it very clear that we will not report. We will do whatever we can to get you cured. And we don't necessarily say because we want to protect our community, but really that's our priority. And where I don't see people getting, so no healthcare provider in the county will treat TB without letting us know. I just feel really comfortable saying that. It's not going to happen. So the only thing that would happen is people wouldn't get treatment, and then we would know because we would see evidence of community transmission. Again, I can't know this 100%, which is why we do all these things to watch the big picture, but I feel pretty comfortable. Mm-hmm.
I think it's really useful that you've provided this information for all of these counties going back to 2014, as well as for Colorado in general, because from looking at this, I cannot discern any particular trend. There's certainly some ups and downs, but maybe until we get the information in for 2024, 2025, I just cannot discern any trends. And these numbers are so small that, contracting TB, because it sort of requires prolonged close exposure, can be significantly skewed, as you said, by family members. But if there were a lot of parolees or undocumented individuals who were spreading this publicly, I would expect to see more of a trend of community cases going up, which fortunately we're not seeing. Is that correct?
That is correct. As I said, one case so far this year, which is really good news. I'd love to see 0, but we're at 1. This slide, I think, is important because this is how we find TB disease. And so it kind of drives our efforts and where we spend our time. So 73% of the folks in El Paso County, we found out they had TB because they had TB symptoms, which is kind of the normal way we find out. Our contact investigations, 12% of the folks with active TB we found through contact investigations, which is why that is a very, very high priority for us. Generalized screening is pretty low, 3%. So we focus our efforts on helping providers evaluate everybody with TB symptoms. And you have to know, TB symptoms, prolonged cough. That's a lot of people. So we help healthcare providers narrow that down and who needs further testing and what further testing that we need, and contact investigation. Next, please. And I just wanted a little overview of our contact investigations. We absolutely identify contacts, evaluate them, and initiate treatment if indicated. And we're very proud of that, and that's a very important thing we're doing to protect our community. Next, please. Any other questions?
No questions, but I want to thank you for coming in and presenting this information to us and being pretty just open and straightforward with your answers and helping us to get an understanding of the situation in El Paso County and the state, and even being willing to speculate on kind of what may be contributing to what's going on through border policy. So I appreciate it.
Thank you.
And Dr. Vu, you had something earlier?
First, also thank you, Susan, for this helpful presentation. And the other is, even though I don't know, my guess is homelessness may also contribute, especially in Denver.
We here are not seeing an increase in tuberculosis among folks experiencing homelessness. Nationwide, that is a risk factor, and in some jurisdictions, there have been outbreaks associated with homelessness. Again, I really should have brought a big block of wood here to knock on, but we have not seen that here. And we regularly communicate with our folks who serve our folks experiencing homelessness. They know where to find us, and they do call. So that's reassuring too. Other questions?
Commissioner.
No, I just wanted to thank you. Very insightful and kind of also, yeah, the only trend that I did see was Denver Metro, right? Arapahoe, Adams, and Denver, and see, but it wasn't so bad previous 2 years, but last year, yes. So at the end of this year, if we see what their numbers are this year, that could be something to speculate about potentially what's happening up in the Denver metro area, but not necessarily here. So, but thank you. I thought it was very insightful.
I think that's it. Thank you very much.
Thank you.
Thanks, Susan. When Councilman Donaldson brought up the question, I think it was at the last meeting that we had, and you followed up with getting exactly the information that we were looking for. We appreciate it.
Thank you.
I just have one more item I'd like to call up, not for you, Susan, Michelle Gunther as our new business operations director. We hired her, and her first day was July 8th, and I would just like for you all to have an introduction to her as she helps me with many of the different logistics as it relates to Board of Health meetings and packet and information and budget also as it relates to some, coordinating with the county.
So good morning. My name is Michelle Gunther, and I'm the new Business Operations Director for Public Health. I grew up in El Paso County, and I'm returning home now with approximately 30 years' experience in business operations management. Started in private sector, worked not-for-profit, international and local government environments, and I most recently worked with finance for El Paso County. So I'm really looking forward to bringing my experience and background to support the important mission for public health and serve the citizens of El Paso County. So thank you for this opportunity.
Well, welcome, Michelle.
Thank you so much.
Okay. Well, I think that concludes our meeting. We do need a motion and second to adjourn.
I'll move to adjourn.
Thank you. And a second? If we don't get one, we stay. Okay, we got a second from Cammie. All right. All in favor of adjournment, let it be known by saying aye.
Aye.
Thank you, everyone.